want to err on over notification and making sure that anybody we think has a possibility of being exposed, having been exposed, we will notify. So we're using a conservative, I call it abundance of caution. We're being pretty generous in terms of creating the list that we're doing. Again, I think the risk is pretty darn small.
And again, I mean, our primary concern is the well-being of our patients and the health of our community, and that's why, though there isn't, though we don't have evidence of transmission having occurred here, we are being very careful and completing a detailed investigation and intend to follow up where that leads us.
Could you talk again about the one patient with hepatitis C? I don't quite understood what you're saying by that.
So there was a patient with hepatitis C who was investigated, and the problem with one hepatitis C case is hepatitis C can have lots of different exposures. There's lots of different ways to get hepatitis C. One of the most common is IV drug use, and we had a patient with hepatitis C in 2012 that we couldn't identify any other specific risk factors. We've been looking at hepatitis C cases through the past since then, and have not found any other hepatitis C exposures that we could tie to PeaceHealth Southwest at all.
Without causing any kind of panic of any kind, but with someone that's maybe a layman or ignorant to what hepatitis C symptoms are, can you guys describe what those are, and do they contact their primary care physician and the hospital itself?
So hepatitis C is, and again, most people who have hepatitis C don't have symptoms. The people who do have symptoms can get nausea, vomiting, fever, abdominal pain. They can turn jaundiced or turn yellow. So symptoms of hepatitis or liver inflammation.
And I think if anybody feels like they're experiencing any symptoms, we would encourage them to reach out to their normal physician if that's where they'd like to go, or certainly they're welcome to call our hotline and we can help them get to the place they need to be.